Buddhist mindfulness cognitive therapy for resolving the mental health problems of depression and anxiety. By Venerable Rungruan Papasaro, Dr. Rungruan Limchu Patapa. Problem statement. The problems of depression and anxiety are very common problems in the modern society nowadays. Recently, in June of 2022 by Harvard University conducts a nationwide survey revealing an astonishing fact that more than 52% of Generation Z is stressed in crisis. This alarming survey addresses a serious concern of depression and anxiety on children of this generation that they are growing up with in a hostile environment. Unavoidably, both depression and anxiety are aggravated little by little inside the mind before bursting out into uncontrollable actions. We can say that everyone has these problems at a certain level, but when becoming to realize of them when the problems are out of control and hurting the public. In the past, these mental illness may be limited to an individual person, and it has very small impact to the general public. However, at present environment it is very easy for general people to access dangerous weapons, therefore an individual problem may impose a tremendous treat to the publics. The problem of mental health crisis is not limited to only the one who poses a major threat to the public, but also includes all the rest of people living in the world who are threatened by harmful activities as well. This is a serious challenge to all of us on the concern of how we can handle and resolve this mental health problem rightly. In Buddhism, the Buddha explained that the core of his teachings focus on how to develop the mind to eliminate all kinds of contaminants or defilements including the depression and anxiety as follows.
I do not perceive even one other thing that is so unwieldy as an undeveloped mind. An undeveloped mind is truly unwieldy.
Objective. The goal of this study is to develop an effective therapy or solution to resolve the mental health problems of depression and anxiety for children of the new generation. An ancient wisdom of Buddhism, as a matter of fact, more than 2,600 years ago, the Buddha also faced a similar challenging mental health problem. He understood that these mental health problems, so-called the lower fetter including depression and anxiety, are not caused by devils or spirits, but it was the internal problem of mind processing with disinformation, so he proposed a scientific way to resolve the problem, so-called the Four Noble Truths as follows. 1. What are depression and anxiety? Depression is a kind of unwholesome thoughts of some unfavorable experiences in the past. Then the mind turns to be in a low-energy dullness mode. Anxiety is a kind of unwholesome thoughts of what may be negative or fearsome to occur in the future, then the mind turns to be in a high-energy or exciting mode. 2. The causes of depression and anxiety. For the depression, the mind is struggling with repeated bad experiences, it will make the mind to be torpid and eventually depressed. The mind is trapped into sort of dreaming, and losing the sense of what is happening at the present moment. The torpor is originated from the ignorance of not knowing the truths of life correctly. As a matter of fact, what happened in the past has already gone, but the mind keeps on assuming a self to bother with the matter, and then keeps on generating a new duplicated mental object of the matter time and time again, starting with an initial thought of ignorance, then being formulated to be a torpor along the course of thought. This is sort of a self-delusion of bad experience in the past. And as a result, this problem hurts the mind to suffer with torpor, and depression of middle defilement, and delusion in rough defilement. For the anxiety, the mind is struggling with fear and being worrisome of what may happen in the future. Although we may plan of some counter-actions to be taken in preparation, but the anxiety will deteriorate the steadiness of the mind to focus on the preparation. The restlessness is originated from the ignorance of not knowing the truths of life at the present moment. As a matter of fact, it is the mind that creates an assumption of self to bother with the matter, and then keeps on generating a new duplicated mental object of the simulated matter by volitional formations in the mind. Starting with an initial thought of ignorance, then being formulated to be restless along the course of thought. This is sort of a self-delusion of something bad or unfortunate to happen in the future. And as a result, this problem hurts the mind to become restless, and anxious of middle defilements, and turning to be a delusion in rough defilement. 3. The objectives: learning on how to abandon all kinds of unwholesome thoughts, including the desire for sensual pleasure, the ill will, the torpor or depression, the restlessness or anxiety, and the confusion or doubt. 4. The corrective action plan to abandon on depression and anxiety. In both situations of depression and anxiety, the Buddha suggested to have a mindfulness at the present moment to pull the mind out from trapping in the depression of the past and exciting from the anxiety of the future as follows.
One should neither run back into what happened in the past, nor be afraid of what is going to happen in the future. Whatsoever happened has already happened, and it arises and fades away. It is impossible to change the past. Whatsoever to happen in the future is dependently on a certain cause and effect. If do it right, then the outcome will be right as well. Especially at this moment, nothing is happening yet. It is important to realize that whatsoever happening in the mind, it arises and eventually fades away. What a depression and an anxiety are about, is just an object of consciousness happening in the mind. Those who has mindfulness at the present moment all day and night, will have nothing to be worried about and to be afraid of. We should have a mindfulness at the present moment because when the mind has received either a stimulus of external mental phenomenon from sense bases or an internal formulated mental phenomenon, if we do not think of whatsoever happened in the past or of whatsoever will happen in the future, and then the mind will not be bothered with any matter anymore. That is, we should not think of what happened in the past, and do not run forward into the expectation of what will happen in the future, but we should firmly keep the mind to be steadied at the present moment only. Then the mind will not be afraid of anything. And the mind will abandon the 5 aggregates subject to cling.
The Buddha introduced a way to use a mindfulness to cognize the nature of the state of mind as it really is. Then when detecting either the mind becoming depressed by something in the past or becoming anxiety of what may happen in the future, and then by having a mindfulness at present, the mind will be able to spin off from depression and anxiety right away. The mindfulness cognitive therapy will be developed from the Buddhist practice in the next discussion.